subtalar joint, and what movement occurs in this joint is the inversion and eversion of foot. This is important for your theory. Inversion and eversion of foot comes in your theory paper. Okay, so these are the joints of the foot, and these are grouped in this intertarsal joint, then tarso-metatarsal joint, intermetatarsal joints, metatarsophalangeal joints, and the interphalangeal joints. See the skeleton of foot. First, this bone lying above is the talus, and this articular surface takes part in formation of the ankle joint. Okay, beneath this talus, this bone is the calcaneum. In front of calcaneum, here is the cuboid, and in front of head of the talus, this is navicular. Okay, and in front of the navicular, there are three cuneiforms. This is medial, intermediate, and lateral cuneiforms. Okay. Next, this cuboid and cuneiforms, they are articulating with the base of the metatarsals. Here is first, second, third, fourth, and fifth metatarsal, forming the tarso-metatarsal joints. And joints in between these tarsal bones, these are known as intertarsal joints. All these joints are included in the intertarsal joints. Next, this head of the metatarsal articulates with the base of the proximal phalanx, forming the metatarsophalangeal joint. Okay, and this this head of the phalanges articulates with other phalanges, forming the interphalangeal joint. One interphalangeal joint is present in the great toe, interphalangeal joint of great toe, and two interphalangeal joints, proximal and distal interphalangeal joints, are present for rest of the toes. Okay, because they have three phalanges, proximal, middle, and distal, and great toe has only two phalanges, proximal and distal. Okay, so this is the foot, articulated foot. This will be the anatomical position of the skeleton of foot. Okay, so this bone is talus. Here is the calcaneum. So near the head of the talus, this is navicular. Near the anterior end of calcaneum, here is cuboid. Okay, here are the three cuneiforms: medial, intermediate, lateral cuneiform. Okay, all these are articulating anteriorly with the metatarsals. 5 metatarsals are there. Here we are counting first, second, third, fourth, fifth from medial to lateral, from towards the great toe laterally. Okay, so here great toe is placed medially here, and for hand we are counting from lateral to medial because thumb was located laterally. Okay, this occurs due to rotation of the limbs during the development. For upper limb, lateral rotation occurs. For lower limb, medial rotation occurs. Okay, so the first, second, third, fourth, and fifth metatarsal, and you can see this first metatarsal is shortest and stoutest. Okay, and this second metatarsal is the longest bone, and this through this second metatarsal passes the axis of the foot. Okay, and around this axis, inversion and eversion, or adduction, abduction, all these are occurring. And mainly adduction, abduction. For inversion, eversion, other axis is present, oblique axis. Okay, we will discuss. So second, you remember, for hand, the axis of the hand was passing through the middle finger, but for foot, axis of the foot is passing through the second metatarsal. Okay, and these are the phalanges. You can see proximal and distal phalanx for the great toe, proximal, middle, and distal phalanx for the rest of the toes. Here distal phalanx is lost in rest of the fingers. Okay, so this will be the anatomical position of the foot. You will hold with this calcaneum. This part is forming the heel. Heel is formed by the calcaneum only. Okay, and there is arch formation. You can see this is medial longitudinal arch, and here laterally this is lateral longitudinal arch, and here is the transverse arch. Transverse half is half in one foot and half in the other foot. Okay, and you also have to read this arches of the foot. They are maintaining factors like this. We will take lecture of that. And now today we will discuss the different joints of the foot. So everyone has seen the bones, different bones in the foot. Now we will see the articulation. First, we are going to intertarsal joints. Okay, intertarsal joints are the joints of the tarsal bones. Okay, all these are joints of intertarsal joints. So these include the subtalar joint, talocalcaneonavicular joint, calcaneocuboid, cuneiform and intercuneiform joints. See here, this is subtalar joint just below the talus. Next, here is the calcaneocuboid and here is the talocalcaneonavicular. These are together forming the transverse tarsal joint or mid-tarsal joint. Okay. Next, in front of navicular, here is the this cuneiform joint. Navicular is articulating with the three cuneiforms. Here it is. This is calcaneocuboid, part of transverse tarsal, and here is the tarso-metatarsal in front of the cuneiforms and the cuboid. They are articulating with the base of the metatarsals, forming tarso-metatarsal joint, and in between the base of the metatarsals, these orange color joints, these are the intermetatarsal. Metatarsals are articulating with each other through these joints. And these two we have already discussed, metatarsophalangeal, interphalangeal. Okay. So first we will discuss subtalar joint. Very important joint. Inversion and eversion of foot is occurring at this joint. So subtalar joint, also known as talocalcaneal joint. See, this is talus, this is calcaneum, here is navicular. So this is subtalar joint in between talus and the calcaneum. So it has an anterior part and posterior part divided by the sinus tarsi. So anterior part, it involves the articulation of convex area of the talus that feeds on the concave facet on the superior surface of calcaneum. Here it occurs anterior talocalcaneal joint, and posterior talocalcaneal articulation, it involves articulation of convex surface of the talus and concave surface of talus. Here is the concave surface of talus articulates with the convex surface of the calcaneum. So this part is forming posterior talocalcaneous joint. And these are the ligaments present in this joint. There is fibrous capsule, lateral and medial talocalcaneal ligaments, interosseous ligament, cervical ligament supports the subtalar joint. Cervical ligaments, it connects the neck of the talus with the calcaneum. And talocalcaneal joint is a plain type of synovial joint. You must remember it, okay? And what is the movement permitted here? It permits the inversion and eversion of foot. Next is calcaneocuboid joint. Here is the calcaneocuboid joint. It is a saddle type of synovial joint. Previous one, subtalar, is plain type of synovial. Okay. Next, this one, calcaneocuboid, is saddle type of synovial. That means articular surface will be concavo-convex. Okay. Like the first carpometacarpal joint. Okay. So it is a articulation between the calcaneum and cuboid. Here is the calcaneocuboid joint, and it is supported by fibrous capsule, calcaneocuboid ligaments, bifurcate ligament, and long plantar ligaments. All ligaments we will see. Next is talocalcaneonavicular joint. This is also important joint. Inversion, eversion occurs here. Okay. So it is a ball and socket variety of synovial joint. Very frequently asked in your Viva, MCQ, OSPI, talocalcaneonavicular joint. Okay, this is a type of joint, is very important. Ball and socket type of synovial joint. Here ball is formed by the head of the talus, socket is formed by the navicular and sustentaculum tali of the calcaneum and the spring ligament. Okay. So it is a compound joint as three bones, talus, calcaneum and navicular forms this joint. Here, this is the ball formed by head of talus, and this is the socket formed by the navicular, spring ligament and the sustentaculum tali of the calcaneum. Okay. So head of the talus fits into the socket formed by the calcaneum, navicular and spring ligament, and it permits the inversion and eversion movements of the foot. Okay. Next is transverse tarsal joint or mid-tarsal joints, also known as Chopart's joint. Okay, all these names are important. This is also one important joint. It is a compound synovial joint, includes the talocalcaneal and calcaneocuboid. You can see talocalcaneal and calcaneocuboid. These two are together forming the transverse tarsal or mid-tarsal joint. And these joints lie in the same plane, but functionally they have different axes of movements, and it helps in inversion eversion of the foot. Okay, main two joints involved in inversion eversion is subtalar joint and talocalcaneonavicular joint, and this mid-tarsal joint helps in this movement inversion eversion. Next we are going to tarso-metatarsal joints. We have already seen these are 5 plain synovial joints articulating with the base of the metatarsal. They are supported by the dorsal and plantar and interosseous tarso-metatarsal ligaments, and they permit limited gliding movements. Okay. Next is metatarsophalangeal joints. These are 5 ellipsoid joints and these are supported by capsular, collateral, plantar and deep transverse metatarsal ligaments. They permit following movements: plantar flexion. Plantar range of plantarflexion is about 30 to 40 degree and dorsiflexion is about 50 to 60 degree. Adduction and abduction. The axis of adduction and abduction pass through the second metatarsal bone. We have discussed. Next is interphalangeal joint. These are 9 hinge variety of synovial joints, and they permit dorsiflexion and plantar flexion of the distal phalanges. Okay, interphalangeal joints. So type of joint you must know for metatarsophalangeal, interphalangeal and others. Okay. Next we are going to different ligaments in details. Ligaments of the foot. It is supported by a number of ligaments, and some of major ligaments we will discuss. Dorsal talonavicular ligament extends from, you can remember from the name. Dorsal means it would be located on the dorsal surface and connecting the bones. Those are named here. So dorsal talonavicular, connecting talus and navicular on the dorsal surface. So that's how you describe it. It extends from neck of the talus to the dorsal surface of the navicular bone. Next is spring ligament. This is very important ligament, also known as plantar calcaneonavicular ligament. It connects the calcaneum with the navicular bone, forming the socket for this joint. Next is bifurcated ligament or internal calcaneocuboid ligament. It is a Y-shaped ligament, extends from the sulcus calcaneae to dorsal surface of the navicular and the cuboid bones. You can see here. See, this is calcaneum, individual bone. Okay, so on the superior surface, these are for the talocalcaneal joint. This part forming the anterior talocalcaneal joint. This part is forming posterior talocalcaneal joint. Okay, and here you can see one groove. This is forming the sulcus calcanea, and this projection is known as sustentaculum tali. This is taking part in formation of talocalcaneonavicular. This is talus. Okay, this part is the head of talus, which again articulates with the navicular bone. This part is body of talus. You can see this part, this blue colored portion, this is taking part in formation of ankle joint. And inferiorly you can see these two areas. These two are taking part in formation of talocalcaneal joint, anterior and posterior talocalcaneal joint. In between these two areas there is a groove. This is sulcus tali. Okay, and this sulcus tali and sulcus calcaneae, they are connected with each other via the interosseous talocalcaneal ligament. Okay, and this ligament is also originating from this in sulcus calcaneum, this bifurcated ligament. Okay, and this head of the talus articulates with the navicular bone, and on the inferior surface of the head articulates with the sustentaculum tali, forming the talocalcaneonavicular joint. I am articulating it with the navicular. This one is navicular, okay. So navicular will articulate like this at the head of the talus, forming talonavicular joint, okay. Okay, so that's how the talocalcaneonavicular joint is formed. Talus calcaneum and the navicular, like this. Okay, understood? And this talocalcaneal joint is known as subtalar joint. So this subtalar joint and talocalcaneonavicular together taking part in formation of in the movement of inversion and eversion. Okay, you understood? And here these two bones are connected by the ligament, spring ligament, okay, which is also forming the socket. So bifurcated ligament is bisected, extends from sulcus calcaneae to dorsal surface of navicular and cuboid bones. Next is dorsal calcaneocuboid. This is superior calcaneocuboid ligament and extends from lateral surface of calcaneum to the cuboid, okay. Next is long plantar, short plantar. I will show the picture. So this is long plantar ligament connecting the calcaneum with this base of the metatarsals. Okay, this is spring ligament or plantar calcaneonavicular ligament connecting the sustentaculum tali of the calcaneum with this navicular. Okay, and you can see here this is short plantar ligament connecting the anterior part of calcaneum with the cuboid, okay, and through this groove passes the tendon of peroneus longus, and here is the talocalcaneonavicular joint, okay. Okay, so we will discuss it. So first is long plantar ligament. Long plantar ligament is also known as long calcaneocuboid ligament. It extends from plantar surface of calcaneum to the groove on the cuboid and the bases of middle three metatarsals. Next is short plantar ligament or calcaneocuboid ligament. It lies deep to the long plantar ligament and extends from anterior tubercle of calcaneum to the plantar surface of cuboid behind the ridge. Next is plantar calcaneonavicular ligament, extends from plantar surface of navicular to the plantar surface of three cuneiforms. Okay. Next is dorsal cuneonavicular, connects the dorsal surface of navicular to dorsal surface of three cuneiforms. So we have seen these pictures. This is peroneus longus muscle tendon is passing underneath the long plantar ligament through this group. Long plantar ligament, spring ligament or plantar calcaneonavicular ligament. Here is the short plantar ligament and this is the groove for peroneus longus. Next is plantar cuboidonavicular, connects plantar surface of cuboid and navicular bones. Dorsal cuboidonavicular connects the dorsal surface of cuboid and navicular. And transverse metatarsal ligament connects the heads of all the metatarsal bones. Anterior talocalcaneal ligament extends from front and lateral surface of neck of the talus to the sinus tarsi of the calcaneum. See, this is plantar calcaneonavicular ligament or spring ligament. This is long plantar, just beneath the long plantar will be short plantar. And this is interosseous talocalcaneal connecting the sinus calcaneum with the sinus tarsi. We have seen this in these bones. This is interosseous talocalcaneal ligament. Here is this is medial arch, okay, medial view of the foot. So medial arch is formed by the calcaneum, talus, navicular, medial cuneiform, first metatarsal and the phalanges of the great toe, okay. Next is posterior talocalcaneal ligament, extends from lateral tubercle of talus to the upper and medial part of the calcaneum. Lateral talocalcaneal ligament extends from lateral surface of talus to lateral surface of calcaneum. And medial talocalcaneal ligament extends from medial tubercle of talus to the sustentaculum tali. All these are talocalcaneum. According to the location they are named. Okay, medial, lateral, posterior. Here you can see dorsal talonavicular ligament. This is bifurcate ligament originating from sulcus calcaneae extending into the cuboid, and it is bisepate, bifurcated ligament. So spring ligament, this is spring ligament or plantar calcaneonavicular ligament. So you must read spring ligament, deltoid ligament, bifurcate ligament. These three are very, very important. Okay, and long and short plantar ligament, only attachments. So spring ligament can individually come as a short note. Deltoid ligament also. These two are very important for theory. So spring ligament, also known as plantar calcaneonavicular ligament. This one, it is thick white band of ligament attached posterior to the anterior margin of sustentaculum tali. Here is the sustentaculum tali posterior to the anterior margin of sustentacular tali, and anteriorly to the plantar surface of navicular. This is navicular, plantar surface of navicular, and the head of the talus rests on the upper surface of spring ligament, and this articular part of ligament is covered by fibrocartilage. Okay, as it was forming ball and socket type of synovial joint. Next is spring ligament is important for maintenance of the medial longitudinal arch of the foot. That's why very important. And spring ligament completes the socket of talocalcaneonavicular joint. Okay, this is the function. Next we are going to long plantar ligament. It is a long and strong ligament attached posteriorly to the plantar surface of calcaneum and anteriorly to the lips of the groove on the cuboid bone and bases of the middle three metatarsal. Here it converts the groove on the plantar surface of cuboid into a tunnel and for the tendon of the peroneus longus muscle. And morphologically, the long plantar ligament represents the detached part of tendon of the gastrocnemius. Gastrocnemius tendon is attached over here in the heel, okay, in the posterior most projecting part of the calcaneum. And long plantar ligament maintains the longitudinal arches of the foot. It helps in maintaining both of the arches, medial and lateral arch. Okay. Next is short plantar ligament. This one is short plantar ligament. It is calcaneocuboid ligament, broad and strong, attached posteriorly to the anterior tubercle of calcaneum to the plantar surface of cuboid behind its ridge, and it lies deep to the long plantar ligament, also maintains the longitudinal arches of the foot. Next is bifurcate ligament. This one is bifurcate ligament. It is calcaneocuboid ligament. Bisepate stem of the ligament is attached to the anterolateral part of sulcus calcaneae, and the medial limb is attached to the dorsomedial surface of the cuboid bone and forms the calcaneocuboid part, and it supports the calcaneocuboid joint. Okay, another limb is going to attach with the navicular. Okay. Next is cervical ligament. Cervical ligament extends upward and medially from the upper surface of calcaneum to the tubercle on the inferolateral aspect of neck of the talus, and it supports the subtalar joint and becomes taut in inversion and limits the inversion movement. Okay. Next we will discuss inversion and eversion of foot. This can come as a short note or part of a long question, very important for theory. Inversion and eversion of foot. See, this is normal position of foot. When the medial border is raised, this is inversion, and inversion occurs up to 30 degree, and these are the muscles involved, tibialis anterior, tibialis posterior, main muscles. And here this, when the lateral border is raised, that is known as eversion of foot. Okay, and eversion occurs up to 20 degree, and these are the muscle involved. Main muscle is peroneus longus and peroneus brevis, and peroneus tertius helps in eversion. Okay, so all those peroneal muscles, they are located laterally. Next, so inversion and eversions are rotational movements of the foot. Inversion, it is a movement in which medial border of foot is elevated and sole faces medial. Okay, And you can say inversion, and you can use these terms when foot is off the ground. So this will be inversion and this will be the eversion. Okay, and when foot is on the ground, then pronation and supination is used. Okay, in that case, inversion like movement will be the supination and eversion like movement will be the pronation. Okay, that you also remember, sometime asked in your viva and also in theory. So these are the joints involved and the axis for inversion, eversion. Axis for inversion, eversion passes through neck of the talus. This is neck of the talus. This is head, neck, body. So neck of the talus. Center of curvature of talocalcaneonavicular joint. Another point passes through center of curvature of subtalar joint. And here the axis of inversion and eversion, and it also passes through back of the calcaneum. Okay. So joints taking part in inversion, eversion are subtalar joint, that is talocalcaneal joint, and talocalcaneonavicular joint. So this is subtalar joint and here is the talocalcaneonavicular joint. These two joints are taking part in inversion and eversion. An accessory joint is transverse tarsal or mid-tarsal joint. Okay. What is the axis of movement? The movement of inversion and eversion takes place around the oblique axis that runs forward, upward and medially. You can see here forward, upward and medially the axis is passing. It passes from neck, back of the calcaneum through sinus tarsi to the superomedial aspect of neck of the talus. You can see here. This will be the axis of inversion and eversion from calcaneum to the neck of the talus. Okay, so axis is passing upward and medially and backward. Okay. So forward, upward and medially. Okay. From calcaneum to the neck of the talus we are seeing. What will be the range of movement? Range of movement for inversion is more than eversion. Inversion 30 degree, eversion 20 degree. And in plantarflexion, the ankle joint becomes less stable and increases the range of movement of inversion, eversion. And in plantar flexion, the narrow posterior part of trochlear surface of talus occupies the large anterior part of ankle mortise, that is tibialofibular socket, and which permits slide to slide movement of the talus. Muscles of inversion. Principal muscles are tibialis anterior, tibialis posterior, and accessory muscles are flexor digitorum longus, flexor digitorum, flexor hallucis longus, and flexor digitorum longus. And muscles of eversion are all the peroneal muscle. Principal muscles are peroneus longus, peroneus brevis. Accessory muscles are peroneus tertius. All these you have to write during inversion, eversion. Okay. What will be the limiting factors for these movements? Limiting factors, the inversion is limited by tension of peroneal muscle and cervical ligament. Peroneal was doing eversion, so an eversion is limited by tension of tibialis anterior, tibialis posterior and the deltoid ligament. Okay. What is the functional significance of these movements? These movements of eversion and inversion help to walk on the uneven ground or sloping ground. And when the feet are on the ground, the movement of inversion, eversion get modified as supination and pronation. Okay. So inversion is supination, eversion is pronation. Okay. So what is pronation and supination of the foot? These are components of inversion and eversion movement. In pronation and supination, the distal part of foot, forefoot, that means the anterior part. Okay, this parts. This part is known as forefoot. Okay, midfoot, and this part is hindfoot. Okay, so forefoot, there is only forefoot. There is a movement because midfoot and hindfoot will carry the body weight. during when foot is on the ground. So distal part of foot, that is forefoot, rotates on the talus and calcaneum, and in supination the medial border of forefoot is elevated. Medial border elevated, that means like inversion, okay, in supination. Whereas in pronation, lateral border of forefoot is elevated, and this movement mainly occur at mid-tarsal joint and tarso-metatarsal joint. Okay, so joints involved are also different. There was subtalar joint, talocalcaneonavicular. Here joints involved are mid-tarsal and tarso-metatarsal joints. Okay, understood? So you remember this. So this is the difference between inversion and eversion. Inversion, medial border of foot is elevated. Eversion, lateral border of foot is elevated. Sole of the foot faces medially in inversion, and sole of the foot faces laterally in eversion. Associate movement, plantar flexion of the foot and adduction of the foot. And eversion associated movement is dorsiflexion of the foot and adduction of the foot. And range of movement 30 degree for inversion, eversion 20 degree. Principal muscles for inversion are tibialis anterior, tibialis posterior. And eversion, peroneus longus, peroneus brevis. Okay. Main joints involved are same, subtalar joint and talocalcaneonavicular joint. And this is associated with inversion, associated with supination, eversion associated with pronation of foot. Okay. Okay, that's all. So you prepare inversion and eversion as your long question and short note also, and prepare the ligaments. Okay, bifurcate ligament, deltoid ligament, spring ligament. Spring ligament is most important, and those joints are very important. Talocalcaneonavicular joint, subtalar joint, mid-tarsal joint. These three joints are very important for foot. And you prepare inversion, eversion and pronation, supination. Okay, so what bones are involved in formation and muscles involved, all these you have to write down. Range of movement, axis of movement, all those you remember. Okay, and you will be asked to identify the bones of the foot during your bones viva. Okay, and foot x-ray can also be given during your OSPE question. So you have to identify the joints in the X-ray plate if it is visible clearly. Okay. And type of joint, very important for your viva and MCQs. For every joint we have discussed in the first part of the class. Okay, understood? Any queries from this area? No queries. Subtalar, talocalcaneonavicular joint and mid-tarsal joint. Okay, these three joints you prepare very well.